This episode of In Focus is being made possible through the support of the Wayne County government.
I wear my mask to keep my family and friends safe. I think it's important to wash your hands because it wipes off the germs. When I play with my friends, we stay 6 feet apart. Keep wearing our masks so we can stay in school. I wear my mask so people don't get sick. I think it's good to wear your mask because it encourages other people to wear their mask.
Hi, and welcome to this edition of In Focus on Whitewater Community Television's WGTV Channel 11. I'm Eric Marsh, Executive Director of Whitewater Community Television. Thank you very much for joining me on this show where we'll have a chance to hear more about what you just saw, the children PSA, which is a public service announcement. Cooper and Nora, find out kind of where that idea came from, the idea of sharing your story about what this pandemic has done to and for you. We're going to be talking a little bit later on with Mary Walker, who was the creator, the thought process, the force behind the whole share your story idea. But we're going to start. I end up in a room with really smart people, and I'm not sure how that works out. So hopefully we can get enough information that we all understand what's going on, and I think that's going to be easy. I have a chance here to talk with Dr. Peter Blair, who is a Ph.D., professor in biology at Earlham College, an expert in malaria biology and genomics. Mm-hmm. I got that one right?
You're perfect.
Okay, that's one. That may be the only one I get the entire show, but I got one. Your ongoing research, or his ongoing research, funded by the NIH, makes important contributions to novel vaccine and drug discovery. Earned his bachelor's degree or undergraduate degree from Berea College, doctorate from the University of Notre Dame. There's some people that are real happy about that.
Good.
Study abroad experiences for students in India, New Zealand, and Peru. Co-director of the Center for Global Health and Integrated Program in Health Sciences at Earlham College, advises students who are preparing to enter medical school and other graduate programs in the health sciences. Wow. Do you have time to sleep?
I tried to get my rest. I think that's important as we all try to stay healthy. Yeah, but thanks for the introduction.
Thank you for spending some time with us. Seriously, I really do appreciate this. And I know I just went through all of that, but that really doesn't tell us anything about you. Give us a little bit of background on you. Where are you from? What brought you to Earlham College? How long have you been involved in this work?
Wonderful. Well, I grew up in that same town. I went to undergraduate college in Berea, Kentucky. I in my biology major as a student there, fell in love with kind of infectious diseases.
How do you do that? How do you fall in love with infectious diseases?
It's an infection of an infection, right? So it's infectious. But you appreciate the kind of the biology of the organisms that cause disease. And I had an experience with a wonderful professor there that gave me firsthand glimpse of that kind of health impact of infectious disease. And so I decided I want to pursue this more. And so I got the opportunity to go to Notre Dame to study malaria. And at that point, it was more the biology of that parasite. It invades your red blood cells and can cause anemia. And so we were looking at how the parasite actually invades and thrives within that red blood cell environment. And as going through that, I maintained that passion for infectious disease and went on to do my postdoctoral work at the Naval Medical Research Center. And this was kind of an exciting time because of technologies that we may get to in a little bit became at the forefront, able to sequence genomes. And the malaria genome was able to be sequenced, so we knew the bases of DNA that made up all the code, the blueprint for life for that organism, for that infectious disease. Mm-hmm. And so that opened the door for vaccine discovery on this parasite. And so being able to kind of mine and sift through that genome, we were able to find some vaccine targets. And so as I moved through that and progressed through that kind of pathway, I moved further away from education. And I'm a passionate person about teaching and watching young people get inspired, get excited about their own passions like I did with infectious diseases. So when an opportunity came that I could continue to teach parasitology and infectious disease-related courses in genetics, Earlham came with an offer. And I came and have been here teaching at Earlham for over 16 years.
Wow, okay. Nice. Obviously enjoy it. Enjoy the interaction with the students. Enjoy the community.
Yep. Earlham students are vibrant, community's dynamic, and my family is happy here. Yeah.
Okay. Before we get deeply into this, talk to me about your tie.
Yes, gladly I will do that. I wanted to make a little fashion statement. You know, I've been socially distant for a while, and so maybe my first kind of outing, I could publicly wear my malaria tie. It was a gift of an Earlham student way back when that maybe I touched a little bit with some insight, and so I gladly wear my perhaps geek-influenced malaria tie. It's a part of who I am.
All right. Talk a little bit for us, and you mentioned being able to help break down the malaria virus and get to a vaccine. Talk to us in terms that we can somewhat understand about how vaccines get developed, because we've heard a little bit about them, expected the ones that we're taking now for COVID to take much longer. They've been able to shorten that. Talk about that.
Yeah, I'm happy to talk about vaccines. I'm really excited about the two that are going to be coming and available to us, the Pfizer and the Moderna vaccines. But I want to back up a bit and maybe do a little bit of teaching. You can't understand about vaccines unless you know about immunology and how your immune system functions. And it's a wonderful and remarkable system. It's really astounding what it can do. Because Eric, when you were born with the ability for your immune system to actually respond to any kind of foreign agent, and particularly infectious agents, so bacteria and viruses, parasites like malaria and fungal infections. And so when you're born, you're able to recognize that. Not just the ones we know about, but newly discovered viruses like this novel coronavirus. So your immune system is able to attack and thwart and hopefully clear those infections, which is amazing on its own. Secondly, your body is really good about recognizing what is self, what are the building blocks that make you you, from proteins to cells to tissues to organs, and what is non-self or foreign. So when you get exposed to something that's foreign, your body can respond to it in a pretty programmed way, and that's your immune system functioning properly. It's also why I probably wouldn't be able to receive a kidney from you in donor transplant, because I would see that as probably being foreign. And so it's your body's recognition of what's self and not self. And this leads into vaccines, because vaccines take advantage of that recognition of self and non-self. So if I get exposed to let's do a virus, let's say measles, for example, for the first time, my immune system's able to recognize that as being foreign, right? This is not part of who I am. It's not part of self, because that's already been programmed early in your life. So it needs to respond and try to get rid of that measles virus. And it starts with this kind of general response. And then if the measles still is spreading in the body, it actually has a specific response to measles. And the outcome of that is actually the formation of a memory response. And so your immune system has a memory, so that when you remove that virus from that primary infection, the next time you see measles, maybe years, maybe decades later, those memory cells, and I'll be specific here, it's your B cells, which are cells that the only cell in the body that can make antibodies, which you've heard a lot about in the past months, and T cells, which we haven't probably heard much in the public arena too much. And I always make sure I give credit to T cells too. But those two types of cells are long-lived, and they're hiding deep within the tissue. So the next time you see measles, your immune system acts stronger and faster than that first time. And that's the beauty of the immune system, that immunological memory that's produced. Now let's relate it to vaccines and maybe COVID for a little bit.
Okay.
COVID is a virus, and actually, my daughter did some arts and crafts last night for me, so I give her credit. She doesn't let me use the glue gun, but this is a viral particle, and it kind of resembles, maybe not the scale, a coronavirus. In the middle of the styrofoam cone will be its RNA genome, so it's kind of its core, and it's got some lipids and some other proteins that make up the sphere, But sticking out from it are these little proteins. And this is actually characteristic of a coronavirus. And so these are called spike proteins. And the vaccines that are being developed, almost all of them, and there's probably dozens of vaccines being developed in the world, are all focused on this protein called the spike protein. And why is that the case? Well, when you get infected, if a person gets infected, if I get infected with coronavirus, my immune system will start recognizing that. And it will look to the surface probably first to recognize something foreign from you. And then it'll take it up in its cell, break it down, and process that coronavirus, and then trigger those memory cells and those advanced immune mechanisms to come into play. So then the second time and third time, maybe months later, if I get re-exposed, I can be immune to that coronavirus. But I would have gotten sick perhaps, right? And I could have had some severe manifestations of disease with a respiratory system or entering the brain. And that's the worrisome part. But we have these vaccines now. And the vaccines are based on either the blueprints of that spike protein or the protein itself. And so vaccines actually are training the immune system. So you're not getting any infection with a vaccine, you're getting a component or a weakened or kind of a inactivated form. And in these vaccines that we're working with now, the Moderna and the Pfizer vaccines that have been FDA approved, it's talking about that spike protein. So our immune system, in that injection of the first and second dose of those vaccines, your immune system is seeing that spike protein, responding to it, and getting that memory. Such that 5 months, hopefully 6 months, and even longer, if we get exposed to the real coronavirus, that heightened immune response of being faster and stronger hits it before it can take hold. And we clear that infection before getting sick and before the severe outcomes, which include death, could manifest. And so that's kind of vaccidology 101, understanding the immune system and how it can form immunological memory, and also with what aspect of the coronavirus is actually part of and a component of the vaccines that we're working with today.
There are a lot of questions still in front of us about what these vaccines can do, how long they're effective, how long before we begin to figure out that piece of it, how long these vaccines are effective, and explain to us, if you can, why Moderna and Pfizer are doing 2 shots, where the next one that it sounds like is coming down the line, Johnson & Johnson, is going to be 1 shot.
Yeah, great questions, great topics too. I mean, the good news is these vaccines that Pfizer and Moderna have produced are kind of gold standard in the level of effectiveness, that 90 to 95% protection that they achieve. Now, we don't know how long that memory is going to last, and those studies still have to be done as we watch those individuals who went through the clinical trials and follow them up to see how that memory is. But we hope it's a matter of, certainly 100 days, maybe a year, but we don't know that yet because those experiments are still ongoing. But the fact that those vaccines were able to, and both Moderna and Pfizer are able to produce 90-95% is very hopeful for us and Wayne County and the globe, for example. And there are 2 doses, you're right. Pfizer's is Moderna is 28 days and Pfizer's 21 days between the shots. It's important to know for all the viewers to make sure you know what you get and what the dates are. And it's not atypical for a vaccine to need 2 doses. One kind of primes the immune response, and that booster often accelerates and heightens the immune response. We get boosters for tetanus that are years apart. So this is normal. The Johnson & Johnson is 1 dose, and we hope that almost as we speak, filming it this week, the FDA might be able to approve that. They're going through the data now and looking and assessing the effectiveness of that 1-shot Johnson & Johnson vaccine. That's just the formula of way that these vaccine companies did their tests. We know that the 2 doses for Moderna and Pfizer at those intervals produce really protective responses. We hope the same for the 1-dose Johnson & Johnson, and I think just following that recipe and that formulation is kind of our best chance for success and, of course, abating the disease.
You're watching In Focus on Whitewater Community Television's WGTV Channel 11. We're spending some time with Dr. Peter Blair, biology professor at Earlham College, who's talking to us about vaccines and immunizations and
Yeah.
viruses and all the things that we are very tired of hearing about, particularly you. You said before we went on the air, this is the first conversation that you've had without a mask in a long period of time. Talk about, as someone who understands the history of these, talk about why that's important for you and that you continue to wear a mask and take those precautions. What do you know that some of us are slow to come to?
Right, right. Yeah, I'm a huge proponent for mask wearing. And I think my father-in-law said it best. He's a former urologic surgeon. And he says, well, can you imagine a situation where if you're a patient, you walk into a surgical theater and you look up right before the surgery and those surgeons aren't wearing their masks. They decided not to wear the mask that day. Maybe you would say, I'm going to call a timeout. And I think I'll wait another day because the surgeon's not wearing their masks. So then you think, why does a surgeon wear a mask? They're wearing a mask to protect the person that they're about to have that surgery upon. They're also protecting other people in the room. They're also protecting themselves. So that's the mindset. When I walk down the street of Wayne County and I'm wearing my mask and I look around, my mindset is, by wearing my mask, perhaps I can protect myself, that's a certainty, but perhaps also I can be a model and actually think from my perspective, I'm spreading the health by that person walking next to me. If they're not getting infected by me, they are actually, and they could be a person I don't know. So it could be a frontline worker, a healthcare worker. It could be a school teacher. It could be a minister. It could be a funeral director. But by my actions and modeling that, I'm actually protecting them. So that's my spread the health mindset. It's a little different outlook than I'm just wearing a mask to protect myself. It's actually a public health service. It's a community level service by wearing a mask. And it's not just a mask. I wash my hands regularly. I think that's important. I keep social distance. When I teach at Earlham, our students are all wearing masks and doing good behaviors like that. And we were able to stay healthy on our campus last semester. And that was something that should be noted as well. But wearing a mask, whether you get the vaccine or not, and I think that's an important point, is still important. If you get the vaccine, you can still get exposed to the coronavirus. You can hang out in your nasal passages, and some of these variants might do, that we'll probably talk about pretty soon, might do that even more because they're more infectious. And so wearing that mask, even if you've gotten the vaccine, is an important step. It's been well studied in the literature and case studies that mask wearing is quite productive in keeping the virus spread down.
Talk a little bit about, and you just mentioned it, the variants that are out there. And there are probably more of them than we're really talking about. We're talking about one from the UK. We're talking about one from South Africa. There's one other, I think, and I don't remember exactly where.
Yep.
But there are probably a lot more variants out there. How do they get started? Are they transmitted the same way?
Fantastic question. The coronavirus did emerge in China with a certain, and that was kind of the original strain of the virus. The one that got to the US actually was a variant of that one. So we already had one variant that's been kind of the spreader in the United States, and that's the version that the vaccines are based on. So we can think about that. But you're right, the three variants that, and they call them in the scientific field variants of concern, VOC. We're not very creative with that kind of acronym, but they are concerning. And I laugh, but it is kind of a serious topic. The three variants we're seeing right now, the United Kingdom, Brazil was the third one, and South Africa. And it's not a surprise. Viruses evolve and they get mutations at a faster rate than other entities. I think the good news about coronavirus is it mutates at a slower rate than other RNA viruses that we all know, flu and HIV. So it's slower, so that's good for us. But it will mutate because we have a pandemic and we have 100 million people, as of this week, have been infected. And so that's a lot of viral load, that's a lot of virus, and it will naturally mutate. And so what's happening with these mutations? Well, it's an RNA virus, and a change of that sequence can actually change the proteins that are expressed. So the blueprint changes, and it can change the protein. And I'll use my example again. And this spike protein, again, is the key portion of what's in the vaccine. And so a mutation in the blueprint could change the shape of this spike protein. And our antibodies that are generated, whether through the vaccine or through a natural infection, might not be able to bind in that place because of that compositional change due to that mutation. And that's the worry, right? That the vaccine, which is based on that strain that was spread in the U.S., is not the same, you don't go to the same effective response. Now, recent studies, and of course they'll be ongoing, suggest that they're still going to be effective. That your immune system just didn't create B cells that made this antibody, they made antibodies that may be bound here or this way or maybe the two, and that will still block that virus from getting inside your cell. And that's a neutralizing response made by antibodies. And so we still think, and we as a scientific community, that the vaccines will be effective. It might be not the 95% level that we're seeing, but even if it's 80 or 70, that's still a great positive response. The second factor is maybe those variants, we don't know if they're going to be more serious once they get inside the body with the other serious manifestations of disease. It doesn't look like they cause more deaths, but we have to wait and see on that. But the immune system will still be primed with a vaccine to that original strain, and based on the robustness of the immune system, the antibody response will be able to probably counter some of those variations. But those mutations, just to be clear, there's many of them, and they're in that spike protein code. And so it's that important protein that's part of the vaccine that's being changed. And so it's a race. It's kind of like an arms race. Can the human immune system evolve at the same rate as the virus? And can we stay ahead of it? And Pfizer and Moderna are already designing, just in case we need them, there's hope that we don't, booster shots that you may need down the road, a third shot. And those third shots could have those variants built in. So with surveillance, we'll find more variants. And so the United Kingdom variant is already in 24 states, at least in the United States. I think of this week, again, timely for this interview, I'm trying to bring some new things. The Brazil strain showed up in Minnesota in a single case this week. And I think we're still learning if the South African strain has come here. But the other news of the week is that, there's travel restrictions in place. And it's not coincidence that those places we mentioned where the variant strains emerged are part of that list as well. So it's all about containing and kind of reducing the effect that those variants could have. So something to certainly be worried about. Science is following them, looking for new strains all the time. But it still encourages us to get the vaccine, which should be still effective, continue wearing the masks, which doesn't matter what the variant is, right? It'll still be protective. And so those good mitigations should still be applied.
How long do you anticipate we'll have to continue wearing masks and social distancing as more people get vaccinated? And we've seen it.
Yep.
We got to stage 5 in Indiana, and it was, okay, we're all good now. It seems like everything's fine. That wasn't the case. We're starting to see people vaccinated, and people are going, okay, there's a number of people now who have that second shot. We can start to drop that. Talk about the time frame as you see it.
Yeah, and my goodness, don't we all want to get back to going to sporting events and games, having graduations, attending weddings, and just being healthy and interacting. And the time frame, it is dependent. We can't say it's going to be an exact date, but I might do a little math for you on the spot. So if there are currently 250 million people in the United States that can get the vaccine, so that's adults over the age of 16, what would it take time-wise to get those all vaccinated if everyone's willing to do so? Well, 250 million people, they each need 2 doses, whether it's the Pfizer or the Moderna, and hopefully Johnson & Johnson comes in, and that may help matters, right, with 1 dose. That's 500 million doses. And so, we're hearing from our government these days, numbers like, if we can get 1 million per day, and now it's 1.5 million per day of this week, we really need to get into probably 2 or 3 million doses per day. Because if we need 500 million.
Per day or per week?
Per day.
Per day?
On average.
Okay.
Because of 500 million, that's 500 million doses that we need. If we get 2 million, that's 250 days. If you do the math, 7 or 8 months, right? If we do the math on the spot. And so January now, that gives us to August, but wouldn't it be great to get that sooner? And so that's kind of the time frame ambitious time frame if we can get additional doses of vaccine. And people say vaccines don't help, vaccinations help, right? It's getting it in the arm. It's getting people willing to take the vaccine. It's people willing to trust that vaccine as being safe and efficacious. And so that's kind of my hopeful timeline. If we can get, and it will ramp up, even in Wayne County, we're going to get more and more doses here. And I think fall might be a good time that we might be able to get back to some normalcy. That may or may not, and we may still be wearing our masks at that time. So I don't want to give an exact date, but I think there's optimism and hope. And thank goodness we have these vaccines as a possible arrow in our quiver.
A couple of things you just said. One, if people trust it.
Yep.
Two, if people are willing to get the vaccines. There are concerns that these vaccines were created and approved for use, even though it's not the final approval. They were approved for an emergency use much more quickly.
Yep.
Talk a little bit about what the normal timeline, if there is such a thing,
Yep.
for the development of a vaccine is. Do you think these vaccines that have been developed so far are safe? And talk to the folks who have some concerns about getting these vaccines so early in their life.
Great question, and thank you. Yes, it is very rapid. It's a remarkable timeline that these vaccines have been doing. The first case in the United States of coronavirus occurred on January 19th of last year, so we've just passed that 1-year anniversary, and we have a vaccine. We have 2 vaccines approved, and maybe a third one coming very soon. It takes normally at least 8 to 10 years from vaccine discovery to actually implementing a vaccine study vaccine into the general public. So what allowed for that compression? It's a number of factors. I think one of the main ones is our vaccine technology platforms were far ahead of what they used to be. And so I'm talking about the RNA technology and some of the adenovirus technology, which is the Johnson & Johnson vaccine. Those have been established. And the RNA vaccine, although it's first applied in its coronavirus vaccines by Pfizer and Moderna, it's been known since the 90s. And so once we're able to get the genome and using genomic technologies of that coronavirus, we're able to amplify that gene for the spike protein, and through also synthesis improvements, we're able to make lots of that RNA. And that adds to the speed greatly. So we have the vaccine platforms available to us. We just had to plug in coronavirus, which we quickly learn about. The other thing is we've got a lot of money, right? Money,
it makes things move.
Yields dividends. So you get equipment and you get personnel, and it makes things move. Urgency with dealing with a pandemic causes these shifts in rapid. The other key part, I think, and this is combined both with why it's safe, and it's still gone through quite a rigorous scientific study. Like all vaccines, it went through phase 3 clinical trials, which means it was tested both for safety and effectiveness on large populations of people, willing people who were able to get the dose. And they should be kind of heroes. The Pfizer had 43,000 people in that clinical trial. Moderna had 30,000. We expect similar numbers that will come out with the Johnson & Johnson report. We were able to learn a lot from those folks, and that wasn't rushed. They had to go through that systematically. And we were able to study the adverse effects, which were somewhat limited. And so the side effects, which are normal, of muscle pain, achiness, maybe a low-grade fever, that was kind of all expected, and we see that. And that's actually your immune system functioning. That's a good sign. When my time comes up for getting the vaccine, I'll rush there and I'll get my injection. And maybe after my second one, I'll get a low-grade fever, and I'll be thinking, all right, this is kind of that superpower of the immune system actually working. And so I'll be happy about that. But on the safety front, if it's okay, Eric, I might like to talk about, I know a little bit about what's in the vial. And I think that could actually help people understand why I think that vaccines, both the Moderna and Pfizer, are safe. And I was able to find some kind of what's in the vial, what are the ingredients for the Pfizer vaccine. And it contains the active ingredient, so all vaccines will have an active ingredient. And the active ingredient is the RNA. And that's the blueprint for the spike protein that we've talked about. And so the spike protein after that vaccine gets into our cells, is made by our host cell machinery. This is what it makes. This protein. I hope the viewers would agree that this is only a small piece of what the entire virus would be. And I'm holding, just for, if there's audio people, I'm holding kind of a viral shape here that has these extensions coming out from it. And so, as I said before, your body sees this as foreign, but it's only a part of a virus. There is no chance of a person getting coronavirus from the vaccines. This is a single protein. Okay, so I want to make sure that's clear with the viewers. There is no chance that you can get coronavirus, the illness, from the vaccine. So that's one part. So the active ingredients in there. And then you hear about these lipid nanoparticles, right? And it sounds like some kind of, futuristic Minority Report kind of terminology.
Yes.
But I've seen my scientific colleagues and vaccinology friends say, think of those as like little packets of butter, because they're lipids, little fats. And they kind of encase that RNA, because RNA is very unstable. And so we've heard about that you need to freeze the vaccines or keep them refrigerated. And that lipid kind of coating helps with that, help preserve the RNA from being degraded before it gets into our bodies. And those lipid, that buttery droplet, which helps get the virus, or helps get the vaccine into our cells, so delivery mechanisms. Otherwise, it's some salts. That doesn't sound too bad, right?
Nope.
To keep the salinity and to keep the pH right. And some sucrose. That doesn't sound too bad either. Some table sugar in there, and the sugar helps keep those nanoparticles from congealing and aggregating together and keep them separate. But that's about it. So just to recap, what I understand is in the Pfizer vaccine is the code for the spike protein, which on its own can't cause coronavirus for people who get the vaccine. And there's some lipids, and there's some sugar, and there's some salt. Those are the ingredients. And there are no preservatives. Some people who have theories about harmful effects of the vaccines with mercury and things like that. That's probably for another show, but there's no preservatives in the Pfizer vaccine. So I always like to know what's in there, if the pharmaceutical companies will provide that information, and that's what I was able to find. And so I'm convinced that there's safety with what's in the vaccine and then how it actually works once it gets inside your body.
You're watching In Focus on Whitewater Community Television's WGTV Channel 11. We're down to our last couple of minutes with Peter Blair, biologist from Earlham College. Appreciate the time. A couple of things real quick as we start to wrap up. There are people who have had reactions to the vaccine.
Yep.
If it is so pure and safe, can you explain to us why that's the case?
Yes, and kind of a two-pronged response to this one. As I mentioned before, your immune system, when you get the vaccine, it is normal to have some soreness and perhaps some achiness. That's kind of an inflammation response of that kind of stage of the immune response activating in cells, and cells are dividing and they accumulate, and these reactions are occurring in places like your lymph nodes. You might have some localized swelling. Those are all good signs. That's showing that you're creating an immune response for the hopes of those memory cells to be made and ready for future infections with the actual coronavirus. So that's normal. But you also read about things like allergic responses, and there has been those, and those have been documented, and that's real. So certainly, I'm not a medical doctor, and I should have stated that earlier. So if you have any kind of history of having allergic response, or you carry an EpiPen, that's always what I've heard, is you should consult with your doctor before getting the vaccine. But I like the plans that are in place, even with the sites at Elder Bierman for vaccine. They make you stick around for 15 to 20 minutes after you get that shot.
Right.
And that's for surveillance and observation. They're there to care for you, just in the rare case that you have some kind of acute adverse response at that moment of, or soon thereafter, of the injection.
What's the takeaway? If you could kind of sum it up, what is it that you want, particularly Wayne County, to know about getting this vaccine and helping us as a county get through the next few months as easily, carefully, and safely as possible?
Great, thank you. And I'm getting one of my soapboxes now. We've heard throughout this, even in February, March of last year, we need to flatten the curve, right? And that's that mantra. And I'd like to take it a step further, because you think of that curve going up of cases, and we get to this point, and some people say, oh, that's the flattening of the curve. We need to say that flattening the curve is down here to flatten it all the way down. We may never eradicate coronavirus, but we can certainly manage it. It's gone pandemic, and so there's no worries of complete eradication. But if we can flatten the curve not at the top, but down here, that's important. And as we were doing this session, we're kind of at this moment of cases, not just nationally, globally, but also in Indiana. We're kind of at this one of these kind of wave downs. This is a good place to be. It's a good place not to be complacent. So we really need to encourage vaccinations, continue the mask wearing, keeping social distance, washing your hands, so we can flatten the curve appropriately. And that's kind of one of my messages I'd like to convey. And bringing it a little bit to Wayne County, I just like to say a little bit about other things, about access to testing and to the vaccines. I think we're in a very fortunate place, actually. The right size town, the right size community. I've gone to get, as you've mentioned in our precast, you've gotten tested many times, and I've probably been 10 or 11 times. We were quite fortunate with our testing sites and the ease of which, so we have access to testing. When I talk to families and friends at other places who had to drive, hour commutes to get tested, and it costs $300 to get tested, and they don't get results in a fast way, we're not the case. I think we're kind of could be a shining star with that. I know there's been hiccups, but when I go there, I get my results. It makes me feel better when I get my negative result on my phone, right? I'm kind of worried if I have a runny nose. It's like, oh, do I have it? No, it's negative. And so the ability to have access to testing, which I think will parlay into the vaccination as well, at our sites at Elder Billman and the Coleman Center. We can actually go there and don't have that lack of access to the vaccine. Of course, we're waiting for more to come, and there will be a buildup. We'll get more vaccines here. And I think, but shows like this and Read Health flyers and propaganda, public health initiatives, we can all learn more about the vaccines and actually how to get back to that normalcy. And I think we can do it. I'm kind of an optimist that way. And so that's what I'd like to tell the community. We're fortunate to have the testing and hopefully the vaccination simplicity, which is one of our virtues at Earlham, the practice simplicity, that we can have access to that. And I think that's what I'd like to kind of communicate to your viewers in the Wayne County region.
Anything I didn't ask you about that you want to make sure you get out there?
I've said a lot. I ramble as a professor, but I think being in this together as a community, you hear things about herd immunity, and herd immunity is really just an understanding about how a community is susceptible or not to the disease. If you have, say we have 100 people in Wayne County, I know this, we have many more, and 90 of them get vaccinated. And we have someone, sorry to do this, but from Henry County who's infectious, who walks into our community, and the disease tries to spread. By having 90 of those 100 protected, those 10 that aren't, and maybe those are the kids who haven't got protected yet, or maybe those are people with compromised immune system, we are playing our part on a community level of protecting our friends and family and community members. I hope that kind of makes sense, because if 90% are protected, the virus has nowhere to transmit. And viruses have to have their human hosts, okay? And so if we're protected, the virus has nowhere to go, we can flatten the curve. And so I just wanted to mention that herd immunity concept a little bit. And the higher we get, 80%, 90%, the less chance the virus has to propagate.
Before I let you go, you got some modeling help from your daughter. Do you want to give her a little shout out?
Yes, I have two daughters. I think Maggie would appreciate the fashionable display of the tie, and Savannah would appreciate me not using the glue gun last night for my coronavirus model. So I appreciate her efforts in helping me out with the interview.
We appreciate you coming in. Peter Blair, Professor of Biology at Earlham College. We appreciate the time. Hopefully we can have you back as things continue to progress.
Thank you, Eric. It's my pleasure to be here. I'm looking forward to following this with you and the community as well.
Okay. We'll take a break. We'll be back with more In Focus in just a moment.
Beyond the Church Walls and WCTV has joined together to produce a PSA to encourage people of color to protect themselves and to protect their families by taking the COVID-19 vaccine shot.
Hi, I'm Patty Brown, a retiree of Alcoa here in Richmond, Indiana. I'm willing to take the shot.
I am willing to roll up my sleeves and take the shot. Are you willing to take the shot?
Hi, I'm Christine Stinson, the Executive Director of the Wayne County Health Department, and I'm here just to let you know that our COVID Vaccine Center is open and ready to serve you. So however you're receiving your information now, whether it's the radio station, the newspaper, or WCTV, or the Health Department social media page, please stay tuned and stay in touch with them. We'll be posting all of the information that way. Look for the time that we call your target population forward, and the registration links will be provided.
Hi, I'm Craig Towns with Reed Health, and I want to encourage you to get vaccinated with your COVID-19 vaccination shot. There's a simple, easy process to do that. Go to ourshot.in.gov and register at the closest location nearest you. We are set up at the Wayne County Fairgrounds inside the Coleman Center. We are here Monday through Friday from 7 a.m. to 5 p.m. and Saturday 9 to 1. I hope to see you there. Please come on out.
Beyond the Church Walls and WCTV has joined together to produce a PSA to encourage people of color to protect themselves and to protect their families by taking the COVID-19 vaccine shot.
I'm Elizabeth Bennett. I'm a retired registered nurse who worked 47 years in the community. I'm willing to take the shot.
Are you willing to take the shot?
Welcome back to In Focus on Whitewater Community Television's WGTV Channel 11. I'm laughing because this show, if you have watched it over the last number of months, for the most part, has been virtual. It's been on Zoom, conversations that I've had. So we're trying to move people in and out in that 2 minutes and 30 seconds when we've been doing this over the last few years. It's just kind of been a thing that we did, and we're a little out of practice. So we've got Mary Walker sitting in the seat. We've moved Dr. Blair out, and again, we appreciate his support. Mary, thank you very much for being here.
Well, thank you for having me.
Have not had a chance to talk to you much during this pandemic, particularly on the air. A couple of things I want to go through, and I know we don't have a lot of time left, but one thing I do want to start with is tourism. You and I, over the last few years, have had a chance to talk a lot about tourism, talk a lot about what that brings to our community. We've had areas that have been hit obviously very hard. Our restaurants, our hotels, our arts organizations have all been, I'll say, crushed in some ways. Talk a little bit about what this pandemic has done to your world, to some of those businesses that we don't always think about hotels.
Right.
We're in our town, we don't
Right.
think about a hotel on the other side. Talk about what this pandemic has done to that industry.
Sure. We are now in almost a year of the pandemic, and when the pandemic first hit and there was the closures for 2 months, that was devastating to all businesses, but particularly the hospitality industry and the not-for-profits such as the cultural and museums and arts. And so when you think about being out of business for 2 months, it was just really incredibly devastating. When we look at hotels, we were talking about 60+% occupancy down revenues down 60% minimum in that time period. It's been that way. It has slowly gone up, but we're still, even this month, which would be this week, we're still at about 38% occupancy. Now, winter is a slow season,
Sure.
but when you couple that and compare that to the same time period last year, it is still down, and it has not recovered completely, but it is on the way up. So, being the eternal optimist, I believe 2021 with the vaccine that we are now being able to get and eradicating this may not be till 2022, and we may not be full eradication, but I do believe that 2021 will absolutely be better in terms of for all of our businesses. The restaurants, I'm working with the Wayne County, Jeff Plaster and Valerie Schaefer and Melissa Vance on doing submitting a grant for Okra and the CDBG monies, Phase 3, looking at a $250,000 grant, again, to help businesses. And in doing that, I was getting impact testimonial emails from businesses, and particularly the hospitality industry. One in particular, it was a retail. She is a sole provider, family of 5. When the pandemic hit, 2 months out, she has gone through her savings. There have been 18 weeks that she has not gotten paid because of being the owner, and but yet she's kept her staff, her employees, and so commendable for that. But I mean, that's just one small example that you can replicate out from a national standpoint, which again trickles down to Wayne County. As of December, 110,000 restaurants have closed or closed long term. And you look at that just in the restaurant industry. Think about the retail. Think about all of those stores, the JCPenney's. And, we love to go shop on Amazon and do our online shopping, but I really want to encourage our viewers to please visit, buy gift cards, do curbside if you don't feel comfortable going in dining, but support our local businesses, all of them, because we don't want them to close and then wonder what happened down the road.
Through part of this, and as you have listened to all of the conversation that's been happening for over a year, you kind of heard some things that made you feel like maybe the community as a whole weren't really hearing the whole story from everybody. We got bits and pieces of things. You kind of started this share your story idea. Talk about where that has come from and where it went. We heard about it here on In Focus. We had Ken Poust here in December, probably the last live or show that we actually did here in the studio. He talked about the group of people that you were putting together. Talk about that group. Talk about what Share Your Story is all about.
Sure. It actually came from a press conference that the city and county had done. And at the end of the press conference, they had 3 businesses, the Leland, Cordial Cork, and Roscoe's, and each gave a different example of the impact that the pandemic has had on their businesses. In the assisted living, it was the isolation for the elderly and how they could not see their family, and that was causing some to lose their will to live. In the restaurant, Cordial Cork, because of being closed, that revenue and being a relatively new business, looking at how do we stay in, how do we hang on, and looking at Roscoe's where they had college students that were manning the front line that people would come in and bully them when they were asked to wear a mask. And you think about all of these aspects, and we hear data all the time. We hear it on the 24/7 news stations, we hear it locally, and data is important. But what I wasn't hearing, and what I felt could make a difference was those stories, the stories that people could resonate with, and to say, wow, that could be my grandmother, that could be my child. So that really resulted in telling those impact stories from a different way versus just data driven, and doing it where it's really the community speaking and the county speaking. And so pulled together a group of about 28 people. They represent all segments of our community, from mental health to healthcare to assisted living to schools to social media influencers to government to media. And then from that we have a marketing segment, and the whole essence of that is telling these stories, and such as Dr. Peter Blair talking about vaccine myths and false and facts, and so we've narrowed down the messaging for this to include things like mental health. Let's talk about that, because there's so many sectors that are affected by pandemic and that we may not realize because maybe we're not in that. But you have mental health, and the suicide rates are increasing. You have the Read Health and healthcare with the first responders and the frontline people that I can't even imagine what they're going through day to day, especially as that pandemic would increase. And thank goodness we're coming down slightly, but we're not anywhere where we need to be. And then you have the schools, where you have the teachers who are having to do a hybrid learning. You have kids who don't understand and can't go and play with their friends, and they may be in school one day and not school the next. And so there's lots of upheaval when you're looking at this pandemic. And then of course all of the businesses, the dry cleaners, the restaurants, the hotels, it's just unimaginable. This is by far worse than what we experienced in the economic crisis in 2008, 2009, by far. And I hope we don't repeat it. But that's really what was the nucleus in starting that, is just how do we resonate this with people so that they will wear a mask, so that they will social distance, so that they will wash their hands. You know, we all have COVID fatigue, and wearing a mask is not the most thing that I enjoy, and no one else. But let's really get this thing under control. Wear a mask, even if you don't believe it works. Just wear it so that you're protecting others, you're protecting yourself, and that we really can get over this, because we can't afford, as a community, as a county, we can't afford another closure of our businesses. And when we lose a business, we lose a business, and it's difficult to bring that business back.
How are you making sure that the messages that you are trying to get out are reaching the entirety of the community? Because there's segments of the community who get their news from various places. Some of them tune into In Focus, some of them listen to the radio, some of them are all over social media. How are you making sure that wherever they are, they're having a chance to see and hear what is being put out?
We're doing our best to do that, and doing that through interviews that are on YouTube. We have a website, which is COVID19WayneCounty.com. We are going through institutions like WCTV, Effective TV, Comcast, and doing 30-second commercial spots. We are also working with our radio stations and doing radio spots. We're working with local media to do articles, to have things on their digital pages, and then just sharing through social media all of this information. It's just amazing. So what I find that's very heartfelt is when you have locals who are being interviewed. Like we just had a couple wonderful gentlemen from the Lunch Bunch, which is a basketball group at the Y. Right. And they told their story. And it's an important story to tell, because that story resonates with people who were probably in the audience saying, "Oh yeah, that's how I felt. I was ashamed. They
were skeptics.
Yes, exactly. And so those messaging, and then they have their own audiences. I mean, the great thing about this is it really becomes viral in the sense that as you have people and they are telling those stories, and those stories get out, and then they go to the COVID-19 Wayne County website, and they can review the interview in its entirety. It's just, we're really trying to do all facets of how to get that message out, because it is an important message, and we all need to do our part. It's not just government. I mean, Wayne County and city government has really stepped in the fact of offering actually 10 type grants and or loan situations for our local businesses, for our not-for-profits, for our food banks, for other things that are so important to our community and to our county. And it's just really important that we also have to do our part. Government can't do it for us. We have to do our part, and that again is making sure, tell your story. If someone has a great story to tell, go on to our website, do a selfie, tell your story, because those stories will resonate with others and make people think again about not wearing a mask, not social distancing, etc.
Real quickly, we've got less than 3 minutes to go. There's a design contest going on right now. Can you mention that real quick?
Absolutely. It's Design a Mask. And so we're working with Black Dog Printing, in which there will be a winner. We're very close to the deadline, which is Friday. But go on the COVID-19 Wayne County site. You can upload the mask design, create your own mask. It's for all ages, kids, adults that are kids, and create your own design. And if it's the winner, we'll have over 400 masks or even more printed, and they will be distributed within the community, within the county. And it's a fun way. We've also done a coloring page that kids can color with saying, "Why I mask?" Because, really what I found through this too is that through kids' eyes, they are very eloquent, very articulate in their way of saying why people should mask, and we need to listen to them too.
Got to be a little bit of positive news, even though hospitality has been down and we've only got about a minute and a half left to go. We've actually had a hotel or two open up.
Yes, we've had the Home to Suites, and that opened up the end of December. We also have the Comfort Suites property that is being built right off of Commerce Drive, and they should be in operation February 2022. And so there are really good things that are happening. So it's not all doom and gloom, but let's get this over with and do our part.
There you go. We want to get back to getting
That's
together
right.
again. Mary Walker, Wayne County Convention and Tourism Bureau. Thank you very much. I appreciate the time.
Thank you.
Sorry the conversation got a little truncated, but
It was fascinating. So
also
I wanted you to do the whole hour, so I just want to go on record saying that.
We'll have Dr. Blair back, I promise.
Super.
Thanks again to Peter Blair from Earlham College for being part of this program. Thank you, Mary, for being here. Appreciate it. A couple of things to remind you of real quick. Volunteers are needed. Wayne County Health Department is seeking medical and non-medical volunteers to assist with vaccination distribution. Definitely check in with them. There's some information there on the screen. Also, the Wayne County Health Department is seeking contract healthcare professionals to administer the COVID-19 vaccine. So we definitely want to, if you can help with that, please do. I want to remind you that if you have not seen all of this program, you can see it on our video on demand site, also on our Facebook page. Thank you very much for watching this week's In Focus on Whitewater Community Television's WGTV Channel 11. Put your mask on. As always, I wish you well. Have a good weekend.
This episode of In Focus has been made possible through the support of the Wayne County government.
I wear my mask to keep my family and friends safe. I think it's important to wash your hands because it wipes off the germs. When I play with my friends, we stay 6 feet apart. Keep wearing our masks so we can stay in school. I wear my mask so people don't get sick. I think it's good to wear your mask because it encourages other people to wear their mask.